Hello everyone and welcome to DHN CXO podcast. My name is Aarti and today we have with us Mr. Joy Chakraborty, Chief Operating Officer at PD Hinduja Hospital and Medical Research Center. Founded in 1951, PD Hinduja Hospital has built a legacy of trust and excellence in care. For last 7 decades, it has been a quality and compassionate care institution. Now, there's a challenge. Whenever we think about a digital shift in a legacy institution like PD Hinduja Hospital, there has to be a balance between preserving trust of the patients and striking a right balance with the digital shift. And that is what we are going to discuss today with Mr. Joy. Thank you so much, sir, for joining us on Digital
Thank you,
Health.
Aarti, for inviting me in this session of podcast.
So let's start with the first question. You have spent several decades in healthcare. Let us start with your journey. Tell us about how you started and your journey till this current role in PD Hinduja Hospital.
So the way you told about few decades, it looks like I'm from the age of Jurassic Park, but it is not as such. So I'm happy that I have spent close to 27 to 28 years in this field of healthcare. And I have seen probably several changes, transition, which have happened over a period of time. And I have witnessed a major change movement from where we were when I started in 1998 and where we are in 2025. So it is not incidental or accidental that I am in the healthcare field, because from my beginning of academic career, I was very much fascinated towards the medical, field medicine. And when after my graduation, I got a chance to pursue my management, I took specialization in healthcare management, and that took me to the area where I am. So way back in 98, when I just finished, I thought of starting my career, though I completed my studies and academic part from Calcutta, but I decided to go to place like Chennai. On those days, we used to consider that as a mecca for healthcare delivery. And I did my internship there, and soon after completion of my program, I have gone and started working in a medical college hospital called Sri Ramachandra Medical College. And it was a great learning opportunity for me, being a freshers, being a person without having any experience, the kind of exposure and all I got, it gave me a lot of rich knowledge and great opportunity to work with some of the doyens on those days in the medical field. So I worked there for close to 9 years, and then the opportunity came here in a place like Hinduja Hospital. I think people consider that there is a great place to work, learn every day, and enrich your professional skill and experience. So I was blessed to get a chance to join here in 2007 as a Deputy Director Administration, and over a period of time I have reached the level of Chief Operating Officer today. And I can only tell you that every day when I work and I learn new things not only from my doctors who are well acclaimed professionals, my management colleagues, but also from the interaction with the patients, as well as my staff colleagues who are quite junior. They may be millennials, but the way they look at things, that is quite different. So it is a great learning, and I consider it is my privilege to work here for close to 19 years and see this major transition.
No, absolutely, sir. I believe along with the institution, 19 years spending in PD Hinduja Hospital is a legacy in itself for you as well. On to my next question, sir. When you started, I think digital was just on the block. It was very rare to have digital technologies within hospital setting. But now if you see, digital transformation has become sort of a buzzword around all the hospitals across India. For a legacy institution like PD Hinduja Hospital, you have been operational since 1951. What are the opportunities and challenges look like in terms of digital transformation?
So if I tell you very frankly, when I started my career, people are not concerned with what is digital. Those days, the talk of the industry used to be if somebody has a proper HIS. If somebody has, they are considered as one notch above over others. In the medical technology part, there were a lot of technologies, digital opportunities were there. But if I talk about patient care, non-clinical areas, it was in a very nascent stage. But as we know, the healthcare sector evolved so much and so much progress happening every day. I think we have, great opportunities even ahead of us too. Now, in Hinduja Hospital, as you mentioned, an organization with 70 years plus legacy, we have also seen the transition. So when I joined here, I can tell you the system and processes were very much in place. The IT system, which was on those days dream for many hospitals, even of our stature, but in this hospital had those things in place. But what we have started doing or working on, we started, dividing the patient journey from pre-hospital, intra-hospital, post-hospital, and even the time when somebody is not part of the Hinduja hospital, but they are looking for a healthcare provider, credible healthcare provider. We started designing the journey and try to see how we can reach out to them and make their life easy and simple just by adopting some of the technologies. Now you know that it doesn't come free, it doesn't come without pain, it doesn't happen without coming across hurdles, and probably we came across or we faced all these challenges, and today I can tell you it has reasonably adopted digital, whether it is in clinical, non-clinical areas, in a significant way, and that has made a good impact on our patient care, patient journey, patient outcome, and patient experience.
That's fantastic to know, sir. When we talk about this digital shift, you have gone through that. You have now in a phase of adoption where patients are adopting these digital technologies. So, when this digital shift happened, what did it mean for PD Hinduja Hospital? Was it more like a technology adoption, or a process redesign, or a mindset change? What was the main aspect of this digital shift?
So, in Hinduja Hospital, we have few principles and the vision of our founder. So, the vision says that quality healthcare for all. And in our mission statement, we have a phrase called patient-centric care. So, if I make a fusion of these two, then automatically you can see that everything gets, gets aligned towards some sorts of system which is meeting the patient expectation, reducing patient pain points. So, keeping those in the mind, when we started working, we have come across several solutions which can make patient journey much better. To give you some examples, the time when we got something like PACS installed, the time when we started speech to text reporting in the PACS, or even you think about a medical technology like gamma knife, all this were there probably the first of its kind in this part of the country or maybe this part of the world. So the step which was taken, or the seed which was put at 20, 30 years back, that has grown over a period of time, and we are very proud to say in this journey we have got enough support from the promoters, from the colleagues, from the professionals, and very importantly our patients. So we keep them at the center of our focus. Whatever we do, we try to see that how it can add value. And if you know that a lot of discussions are taking place today, I'm telling it is very pertinent today, that value driven healthcare or healthcare value chain, and those are not coming that easily without having pain. So probably we are working on that, and we'll get the success in coming days too.
In a hospital, sir, as well as the clinical team, there's an operational team which is very important to, maintain the prestige and the quality of care. Uh, how do you ensure that there is a seamless patient experience and also internal efficiency? How do you approach this balance?
So first to tell you that we can't consider something as an efficiency unless and until it is meeting the patient experience. So what we have done, probably we are the first hospital, best of my knowledge, at least in this part of the country, we undertook something like a Lean Six Sigma study. And in the Lean Six Sigma study, what we have found, some of the patient pinpoint where patients they felt they need to, when they call or when they ask for some information, they need to be attended in a much efficient and better way. So keeping that in the mind, we created a call center, and which is at least 30 kilometers away from this hospital, but when a patient calls, they don't know that where they are calling.
Wow.
Why I give this example? Because a lot of time we hear about this issue from the patients, whether our hospital or other hospital, that my queries are not answered, I was looking for a response, didn't get. So that is the kind of approach has been taken. Now, what we have done, as I told before also, that we made the patient journey and we try to see how it can add, what kind of technological intervention, digital intervention can add value. So whether it is pre-hospital visit, so for example, we have a system where a patient who has taken appointment, they get the previous day a automated call, and there they can decide whether they want to still come or they want to reschedule. So instead of getting once again the challenge if they want to reschedule by calling, this automatic call, they record, register the patient request and intention, and they can reschedule without further delay. Now if you tell, is it efficiency? I'll consider it is an efficiency. Does it incur cost? Yes, it incur expenses. For a simple reason, you have to create the platform. But think about the efficiency and the satisfaction, patient experience part. The efficiency is that the chance of losing a patient is becoming less.
Yes.
Patient experience is they need not to call second time to get the response and reply. So we have made that. Similarly, if I take example of making reports available for the patients, whether it is radiology, lab or any services, we have invested heavily to create the platform that patient they need not to come and look for reports without waiting much. The moment the reports are released by the doctors in the lab or radiology department, that gets triggered to their preferred number or email ID. So basically that is bringing down the waiting time, that is bringing down the time a consultant could take to give a diagnosis for a patient. Now, is it efficiency? For me, it is efficiency. Is it giving patient experience? It is giving tremendous patient experience. So when you work for this efficiency, I don't think you should work for creating a system which adds value for the enterprise, for the organization, but doesn't add value for the patients. So we keep both, we look at the balancing part of it, and we adopt those which makes true balance between both aspects.
That's what you explained, sir, very beautifully, is the patients interacting with the hospital. Now let's come to the doctor and patient interface. You have new technologies, telemedicine, online portal, maybe AI-driven speech to text, as you rightly said. How has that impacted the patient and doctor interface, as well as what is the impact you have seen in overall quality and patient satisfaction?
Specifically, if I talk about the doctors and patient interaction or that particular engagement, I can tell you today I have reports, records of the patients available in the digital format. So when a patient comes and if the patient's records are not there with the patients, without any delay the doctors can retrieve and they can start the treatment. At the same time, we have system in place where the speech to text conversion, not only for the radiology reporting but also things like discharge summary and all, which are giving good support for the patients. Waiting time for the discharge get reduced. If you think about another very important aspect, that how do you give digital prescription and all, we have worked towards those things, so it goes hand in hand. Another part is, I'll not say only digital technology, but it is also AI based support, where patient monitoring. If a patient who is not in the ICU, but you may not know the kind of changes happening within their health parameters, so we have adopted technology where it gives early warning sign which triggers action towards amongst the nurses and doctors, so they can attend the patient quickly. So those kind of things have been taken. Is it going on very well? I must say that reasonably well acceptance and adaptation have taken place, and I'm sure it is going to improve the patient quality of life, and that is exactly what we are looking for in terms of quality of life of the patient as well as the quality of care we intend to deliver.
Now, data is the new oil, sir, and I think healthcare data is sort of like a gold mine of all the data points. And in a hospital like PD Hinduja, you have been operational since 1951. There's a massive amount of data. And in the new era of digital technologies, we are talking about preventive healthcare using these data points to ensure that there is a personalized care delivered to patients. How do you ensure that you leverage this data, and also with respect to the aspects of privacy and ethics, how do you balance these aspects?
So when you talk about data, you mentioned about in terms of the healthcare delivery part, but I'll also tell this hospital has a very strong research department. So that research department undertakes a lot of research along with our consultants, and there these data play a very important role. And when you say also about this ethics and ethical approach, we have the internal ethics committee, institutional ethics committee and board, which checks, and then after their approval only things are undertaken here. Now, apart from research, if you think about, you mentioned also about the individualized medicine. So we have taken several AI based tools we have adopted here. We have made effort in some of the particular disease condition, whether it is stroke, whether it is cardiac issues, the adaptation of new digital platform where these data are giving a lot of eye openers, or they are becoming very useful to come to a conclusion, to come to a diagnosis. And I think that is going to take us in a very long way in coming days also. And I'm sure this beginning is going to take us through a roller coaster ride, but it is going to be ultimately get benefit for us, going to be something which all of us will cherish.
In many hospitals, sir, when we talk about adopting digital technologies, one of the major bottleneck is change management. How do you ensure that the stakeholders who are actually using the technology, the doctors, the nurses, the paramedics, are going to interact with technology, and how they are going to adopt it? How has been your journey in the change management perspective in PD Hinduja Hospital, and how do you ensure that there is meaningful use and not just a top-down approach wherein the management has said you have to use it, so the doctors are using it?
So when you said initially about 7 decades plus existence of this hospital, you must also know that in this organization, the employee association is very long. So if you look at the doctors, nurses, very significant number of that community you will see are here for more than 15-20 years. And that long association creates some sorts of bindings with the organization, and at the same time their emotional attachment to the organization is also very strong. Why I say this? Because when they take the ownership of their role in patient care, they need to be really made part of any of this change management. We cannot just make it like a
Yes.
top-down approach. So what we do, we at the time of any decision making situation, we involve them from the beginning. We hear them out, we may ask them, and we may change some of the decisions on the basis of their inputs, and that leads to a stage that when finally it is adopted and it is been undertaken, it doesn't fail. And that is the way I must say inclusion is the best possible approach when you go for any change, and that we have adopted here. India is the largest democratic country, and I can tell in that way this hospital probably is one of the huge democratic organization where even a junior most attendant will have their own say and their inputs are considered here. So that kind of symbiotic environment and relationship helps us to adopt something new what we try to adopt.
Sir, I have just last two questions for you. What next for Hinduja Hospital now? What are the new technologies that you are looking to adopt?
So, if you ask me new technologies, I think it is changing every day. One of the new animal which has come in the whole ball game is the artificial intelligence. So, we are working on several projects where AI is involved. Apart from that, if you ask me about digital, so we are in the process of changing our HIS. We are going to change our ERP solution. We are going to have a good CRM. All this, it is not that we didn't have, but considering that there is a change taking place across in the external environment, we have also decided to change. So that is going to be the other one. And third, in terms of medical technologies, I think it is so evolving that we need to keep our eyes and ears open to understand these changes, and it is a ever evolving process. So we take due consideration. Every year we spend more than 100 crores of capex to get those kind of new changes, new technologies placed in the organization, and we will continue to do that.
So my last question to you. Post-COVID, there has been a massive churn in the healthcare ecosystem, from adoption to digital technologies to finding out a lot of gaps in the way the care is delivered, to the investment. A lot of changes, transformational changes are happening in healthcare. What would be your advice to your peers, the administrators, to how to keep up with the trends?
See, as I told you in the previous question, that the market dynamics are changing very fast. Now, one of the things which comes up almost every alternate day in the media, who is the owner of the hospital today? So, a lot of private equity firms, investment from abroad are coming in India, and if I look at the private sector healthcare, slowly and steadily they are going to dominate probably the big size or mid size segment. So, if that is going to be the rule of the game, that you have to get this funding and automatically in 3 to 5 years time you need to return back the investment and it goes to somebody else's hand. So my advice will be that we need to be prepared in this journey. So when I started my career, forget about AI, the concept of digitization, digital was not there. So what we are required to do, we are required to see and keep ourselves in that pace of change, that what are the new things we need to do. We have to learn not from only the Western world, but also within this country, whatever is happening. One important part, we need to see how we can standardize our practices. When I say practices, not only clinical, even in non-clinical, how we can collaborate. Because this collaboration is going to give us a major, support in terms of our own development. So how do we do that? And finally, I will tell you that whatever you do, we should have the best intention, and we should have some sorts of something not only meeting the legal requirements but crossing the ethical borderline. So when we have all this together, I'm sure we can excel, because all of us are human beings, all of us have our IQs to improve ourselves and deliver the best for the interest of the people.
Thank you so much, sir. Thank you so much for your time and for this interaction. I'm very sure whoever is watching this video, your peers might have a lot of takeaways from this conversation. Thank you so much for your time,
Thank you
sir.
so much.